The latest solution from my friends on the other side of the aisle is some sort of Medicare for All proposal. And yes, we did ask for a hearing on it because I think it's something that Democrats ran on, believe in fully, and we should take time to understand it. We know this plan would take away private health insurance from more than 150 million Americans. We're told it would end Medicare as we know it, and it would rack up more than $32 trillion in costs, not to mention delays in accessing health services. So, Madam Chairwoman, other committees in this body have announced plans to have hearings on Medicare for All. Speaker Pelosi has said she is supportive of holding hearings on this plan. And, Madam Chairwoman, I think I read you yourself said such hearings would be important to have. A majority of House Democrats supported Medicare for All in the last Congress. In fact, 2/3 of the committee, Democrats, 20 members, 11 of whom are on this subcommittee, have co-sponsored the plan. I think it's important for the American people to fully understand what this huge new government intervention into health care means for consumers if it were to become law. Yesterday, Dr. Burgess and I did send you and Chairman Pallone a letter asking for a hearing on Medicare for All. And we think, as the Committee of Primary Jurisdiction, that just makes sense. So as you're organizing your agenda for the future, we thought it was important to put that on it. The American people need to fully understand how Medicare for All is not Medicare at all, but actually just government-run single-payer health care. They need to know about the $32 trillion price tag for such a plan and how you pay for it. They need to know that it ends employer-sponsored health care, at least some versions of it do, forcing the 158 million Americans who get their health insurance through their job or through their union into a one-size-fits-all government-run plan. So if you like waiting in line at the DMV, wait until the government completely takes over health care. Seniors need to fully understand how this plan will affect the Medicare Trust Fund that they've paid into their entire lives and the impacts on access to their care. Our tribes need to understand how this plan could impact the Indian Health Service, and our veterans deserve to know how this plan could pave the way to closing VA health services. So the question is, when will we see the bill, and when we'll have a hearing on the legislation?